Hello, future doctors. How are you all? Welcome back to MedSteps ECG series, day 18. So, in our previous lecture, we have learned about atrial fibrillation, which is an irregular rhythm with no P waves. So, today we will learn another important atrial arrhythmias, the thing we call atrial flutter. So, this rhythm has one of the most recognizable ECG patterns and the sawtooth pattern. By the end of this lecture, you will be able to differentiate with atrial flutter from atrial fibrillation. So in less than 1 minute, we are going to easily you can identify. Okay, so I'm really thank you because our channel reached 4K subscribers and we are getting good views and everything. So if you didn't subscribe the channel, like, share and subscribe. If you have any doubt, you can comment in comment section. Okay, so myself, I'm Dr. Anand, final year medical student. So without time waste, let's begin. What is atrial flutter? Atrial flutter is normally the SA node sends one electrical impulse that spreads through both atria and um, atrium in right atrium. Okay, so in atrial flutter, a single re-entry electrical circuit rapidly circulates into in the right atria, usually in the right atrium. So here most commonly we can see in right atrium, instead of one normal P wave, the atria depolarize very rapidly. So the atrial rate is usually you can see 250 to 350 beats per minute. If you're seeing here, this is the best definition, best analogy I can give. For example, imagine cars moving smoothly around this round path. Okay, so now imagine one car gets stuck driving in circle continuously. That repeating circular movement is called a re-entry circuit. So this continuous loop produces atrial flutter. Okay, so what happens in atrial flutter? If you're seeing here, normally first you can see rapid atrial impulses. Then after the AV node will blocks with many impulses. Then after you can see here only some impulses reach the ventricles. Then the ventricular rhythm may be regular or sometimes irregular depending on atrioventricular conduction. Okay, so next you can see here that is ECG features of atrial flutter. So in ECG features you can see here we have to look for this classic findings we called sawtooth flutter waves. If you're seeing here, this is the sawtooth flutter waves. You can see this type of flutter sign. Okay, this is flutter sign. So this type of F waves you can see instead of normal P waves, you will see here sawtooth F waves. These are the best seen in lead 2, 3 and AVF. That means inferior wall. In inferior wall, we can see this sawtooth appearance mostly. Sometimes in V1 also we can see. Okay, so this is the hallmark of ECG features, that is sawtooth flutter. Next we can see atrial rate. What it means? Usually the heart rate will be like we can see 250 to 350 beats per minute. Most commonly around 300 beats per minute. Okay, so next we can see ventricular rate depends on AV, atrioventricular block. If it's 2:1 block means 150 beats per minute, we can see ventricular rate. 3:1 means 100 beats per minute. 4:1 means 75 beats per minute, you can see. Okay, next you can see here that is QRS complex. In QRS complex, usually we can say narrow, and unless there is a bundle branch block or pre-existing conduction abnormalities, we can see QRS complex. So here you can see this is the narrow QRS complex. Okay, next one, why does the ventricular, next you can see here why does the ventricular rate will change? Because whenever you are seeing here, the AV node acts as a protective filter and it prevents all atrial impulses from reaching the ventricle. Example, you can see atrial rate. Okay, for example, you can see atrial rate. In atrial rate, you can see here 300 beats per minute, and in this 300 beats per minute we can see with 2:1 ratio, and AV block, only every second atrial impulses reaches the ventricles, the heart rate must be 150 beats per minute. So now we are going to discuss about causes of atrial flutter. What are the causes we can see? So we have one mnemonic we call flutter. F means failure, like heart failure. L means lung disease. U means uncontrolled hyperthyroidism. Thyrotoxicosis. T means thromboembolic risk. And E means ethanol or alcohol consumption. R means somatic or structural heart diseases. Okay, so in causes we can divide into two different types of causes: cardiac causes and non-cardiac causes. So in cardiac causes we can see coronary artery disease, heart failure, valvular heart disease, cardiomyopathy, and previous cardiac surgeries. Next one, non-cardiac causes we can see COPD, pulmonary embolism, hyperthyroidism, alcohol, and electrolyte disturbances. Okay, next we can see some symptoms. In symptoms, mostly if patient present with atrial flutter, the patient may experience with like palpitation, shortness of breath, fatigue, dizziness, and chest discomfort, and some patients will be like asymptomatic. Next, in clinical features, in like atrial fibrillation, atrial flutter can lead to like blood stasis in the atria and clot formation and ischemic stroke. Stroke prevention is considered using the same risk assessment principles as atrial fibrillation. So for example, when I'm doing cardiology department, that time I saw one patient with atrial flutter. So I want to mention that clinical scenario here. Actually, when I'm doing cardiology department, 68 years old man with palpitations, the patient present. The ECG shows sawtooth flutter, same to same like atrial flutter, and ventricular rate will be like 150 beats per minute, and the QRS is narrow. So the atrial flutter with 2:1 conduction, we can see here. Okay, so that is like that we have to diagnose atrial flutter. Now, how to differentiate atrial flutter with atrial fibrillation? So in atrial flutter, the P wave will be absent. Same to same in atrial fibrillation also. Baseline in atrial flutter, we can see sawtooth F waves. In atrial fibrillation, we can see fibrillatory waves. In rhythm, often regular. Atrial fibrillation rhythm will be like irregular rhythm we can see. In atrial flutter, we can see the heart rate will be like 250 to 350 beats per minute. It's low compared with atrial fibrillation. In atrial fibrillation, we can see 350 to 600 beats per minute. The risk of stroke in both we can see increased because of atrial fibrillation, because of atrial flutter, the thrombus will form. Then directly it will affect directly the thrombus will go to brain. Okay, then the patient will get stroke. So now how to recognize the patient, how to diagnose the atrial flutter quickly in within 1 minute. Whenever you are seeing ECG to interpret it, we have to ask ourselves, we are seeing sawtooth waves or not. Is the atrial rate around 300 beats per minute or not? If you are seeing this 2 positive, then the patient have the diagnosis will be like atrial flutter. So what's the basic management? How we can do the management with the atrial flutter means we have to control, we have to treat depends, we have to do treatment depends on whether the patient is stable or unstable. The main options include like rate control, we have to control the rate, then after we have to control the rhythm, like including like cardioversion in selected patients. Next we have to do catheter ablation. This catheter ablation is highly effective for typical flutter. Then after we have to do anticoagulation when indicated to reduce stroke risk. Okay, so we will discuss this detailed management when we are doing future arrhythmias lessons in cardiology series. Okay, so in hallmark, if you are preparing for any competitive exams, the atrial flutter hallmark will be like sawtooth flutter waves. This is the main thing, and the atrial rate will be like 250 to 350 beats per minute. The most common ventricular rate 150 beats per minute, 2:1 AV block. And whenever patient have atrial flutter, they are very prone to get risk of stroke. The common causes heart failure, COPD, hyperthyroidism, alcohol, and structural heart diseases. Okay, so these are the main things. So excellent. So today we'll learn how to identify atrial flutter and distinguish it from atrial fibrillation. So in day 19, we will learn about supraventricular tachycardia, very important topic, including its ECG features, causes, and how to differentiate it from sinus tachycardia. Okay, so see you in our next MedSteps ECG lesson series. So I covered everything about atrial flutter. I'm signing off, Dr. Anand.